Following his term as a page.
This meeting is being recorded.
With the South Carolina Senate and graduation from University of South Carolina with a degree in political science, Mason was appointed to serve as a legislative liaison for the South Carolina Department of Probation, Parole, and Pardon Services. He returned to the Senate from there after serving several years and served as the research director for the General Committee, then the Invitations Committee. Mason took a position with the Legislative Audit Council before returning to the Senate, where he has now served as the lead staffer for Senate Family and Veterans Services Committees for the last 5 years. Mason has a master's degree in public administration from the University of South Carolina, is an Eagle Scout, an executive board member of the Indian Waters Council, Boy Scouts of America, and has served on numerous policy committees with the National Conference of State Legislature and Southern Legislative Conference. His main policy areas focus on child welfare, human services, veterans, aging, and vulnerable populations. So with that, we thank both of these people for joining us this afternoon. And we're going to jump right into some of the questions that have been submitted so that we can try and work through these. Hopefully we'll have some time at the end if there's any additional questions. As Beth said, if you can put them in the chat or if you want to shoot them over to us, we'll try and get through those. So we'll start off with paid family leave and some of the discussion around that. Last year, Government McMaster signed into law S11, a bill that was sponsored by Senator Shealy that co-sponsored by Representative Felder, that gave state employees 6 weeks of paid leave for the parent that is primarily responsible for the child and 2 weeks for the other parent. This session, there's a pre-filed bill, S27, that includes university and technical college employees and increases the time off from 6 and 2 weeks to 12 and 4 weeks, respectively. A similar bill has been filed in the House. Questions for both Representative Felder and for Mason. How else can the state support employees that have children or want to have children? Representative Felder, if you want to start.
Okay, I'm sorry, on a Zoom, you don't want to speak over someone, so I apologize. I do think that we as a state, not only for state employees, but we need to make adoption of children easier and more accessible and more affordable. I think that is something that we can do that not only helps state employees, but also helps the growing number of children that we have in our foster care system.
And certainly to build off of that, as we all know, childcare has become increasingly more expensive, making it nearly impossible for a lot of families to be able to afford having children and also work in the workforce, especially those without a strong family support network around them. We need to figure out a way to make childcare more accessible, less expensive, but also ensure that childcare employees are paid a living wage as well too. Along with that, Senator Shealy has also introduced legislation to make all school meals accessible to all children in our K through 12 public schools. That would go a long way towards bridging some of that gap. And then the expense that we see for our families, I believe the last number I saw in order to raise a child up through 18 was in the neighborhood of $300,000 to $350,000. That takes just a bare minimum to be able to afford to raise a child. And for many of them, it's much more than that, especially in our urban areas. And so there's a lot of ways that we have to tackle this. And I think we're going to get to that in some of our questions later on.
Thank you both. There's also been discussion about expanding the leave bill that we were talking about. First, back to that, do you think there's a chance of it increasing the length of time and to include the other populations that have been suggested. And even further, I know there's some question about including state teachers in the state. Do you think there's likelihood that it would be expanded to include the other community college employees and other groups that have been mentioned?
So I think that there's kind of two parts to it. The bill S-27 that's been introduced in the Senate and the House kind of does two things. One, it expands out to 12 weeks, which was the original language from S-11 in this past session that did get passed, but we had to compromise down from 12 to 6 weeks in order to get it through the Senate chamber. But the other part of it is kind of closing this loophole that especially a lot of our university partners fall in, especially like research grant positions that wouldn't normally be covered as FTEs within the state. That was kind of an oversight on our part whenever we were doing the negotiations. So hopefully at least we can get that loophole fixed for our university partners. Moving it up to 12 weeks is a little bit of a heavier lift, and certainly moving it out to the school districts would be even heavier than that. But you never say never. It took us this long to get 6 weeks. I think there's still some runway left in this legislation, especially since there's been a lot of discussion about what it means to be pro-life in South Carolina, and these are both really good pro-life positions to support our families and young children in the most important time of their life, whenever they're first born.
I would have to agree with that. And I will admit that when we said state employees, I was not aware of all the different classifications and how many people that work for the state of South Carolina in one capacity or another was not included in this. I do think it's going to be a difficult lift to include teachers in that contractually that is between the teacher and the district. And each district can have a different benefit package. And some of them now offer some leave time and others don't. So I'm not sure from a legislative how we could incorporate teachers without it being an entirely separate piece of legislation that focuses on teachers and school districts and funding those.
Well, thank you. I can appreciate from your standpoint, both of you, that there are so many nuances with the way organizations in state government are set up, that is, it's hard to encompass everything when you're just trying to do the right thing and get the bills introduced, first of all. So I can appreciate that. One other thing that has been highlighted, unfortunately, in our state over the past couple of years is, and especially since the pandemic, the focus on mental health and particularly around children's needs. The Joint Citizens and Legislative Committee on Children spent several hearings listening to some of the challenges that the schools faced with regard our children in our state faced when the schools were forced to close. Representative Felder, you sponsored House Bill 3458, a bill that prohibits school boards from preventing behavioral health services to a public school student during school hours when they have parental consent. How does your bill help address the needs for school-based mental health services and help students and their families with these problems?
Well, the legislation came about after one of our fall meetings with the Joint Citizens and Legislative Committee on Children. We had a parent that came forward and was able to find a great behavioral health therapist that his child worked very well with, was making great progress during not being in person in school. But of course, when the COVID situation ended, the child is now back in school in person, this behavioral mental health practitioner was not able to go into the school and continue the therapy with this child. So then it's to take on another therapist that, you know, I'm sure is equally as qualified, is equally prepared, but you still take a few steps back when you have to start all over. So the parent was just saying, why? You know, why can I not choose to continue to use this therapist that is getting compensated for their time? Why can't they come into the school so that we can make this an easy transition? And I got to talking to some districts about this, and apparently there's a hodgepodge out there. Some districts allow it, some districts don't. But I think that we have a shortage of behavioral health in our state. I mean, there's just not enough of them to go around. So I think anything we can do to make sure that child is getting consistent therapy, consistent resources is something we have to focus on. And I'm sure I'll have some pushback somewhere that do not want to allow them in the schools, but that is a public building. Children's mental health is in a sense of a public crisis now, and I think we need to do whatever we can.
Could not agree more with Representative Felder. It really boils down to kind of two words: access and coverage. Representative Felder is certainly trying to address the access part of it, and just getting good help is sometimes the hardest hurdle, unfortunately, even beyond insurance coverage. You know, as we saw through the pandemic, there's certainly a rise in salience of this issue. People are talking about it more. People are more free to discuss it. It doesn't have quite the same stigma that it used to, but there's still a lot of work that we have to do to that end. But also on the coverage side, you know, a lot of insurance companies still don't pay what providers are asking for and what providers honestly need, especially with the scarcity of providers that we have in South Carolina. So those two pieces, access and coverage, will really help get us to where we need to be. It's going to be a long road ahead. It's going to be an expensive road ahead. It's going to take some investment on our part from the General Assembly's point, but it's also going to take working with our partners in the insurance industry, within school districts, and other places too.
Well, I applaud your efforts in this area because this is a long-standing need, and unfortunately, as we mentioned, was highlighted even more during the pandemic and as people resumed activities and some of the challenges that were brought to light during that time period. I know that there will be continued focus on that. And as you said, Mason, you were talking about some of the challenges from a budgeting standpoint and some of the implications. 3 years ago, policymakers were worried about the budget implications of COVID-19. Thanks a lot for the federal COVID relief funding and smart budgeting by our General Assembly in the past couple of years. South Carolina has a large influx of one-time funding and a smaller amount of new recurring funding. Questions for both of you. What do you propose that the legislature use this influx of one-time funds for?
Well, I do think the funding.
Yeah, you go ahead, Representative.
Like I said, it's hard on a Zoom. You don't know. I do think funding technical college out of some of this COVID relief dollars, that's a game changer for a lot of our underemployed people that now have that opportunity to go to technical college to better their employment opportunities and to earn a better livable wage. So I'm really proud of the focus that the governor has put there to try and give these opportunities to more South Carolinians. I do think one of the the big ticket items that we have to look at is now that we have children back in school, but they are behind. They lost out 2 years of classroom instruction. And now, again, a lot of our students did fine through that. They had the parental guidance at home. They were able to do the virtual classes, and they're good. But we have a large number of our students that did fall behind. They need extra help to get them where they need to be. And I think we need to look at possibility of having longer summer camp, if you will, opportunities for these students that are behind so that they're prepared for the next grade level.
Absolutely. And so one of the things that Senator Shealy has been working on a lot over the last year or two, especially, is some of our really vulnerable kids, especially those who are dual involved with DSS or DDSN, DMH, and DJJ as well too. A number of years ago, there was a state-owned, state-run psychiatric residential treatment facility that we call a no eject, no reject facility. So the facility could not refuse a child that needed care to come in. Maybe there weren't beds elsewhere in a private facility, but they also couldn't eject them for whatever, maybe behavioral reasons or because they couldn't handle their particular diagnoses or whatever it might have been. That was closed down about 15 or so years ago. And there's been a large effort to try to revitalize that facility here in the Columbia area to be able to serve the state kind of statewide. But also as a part of that too, one of the reasons why it was shut down is certainly after the 2008 housing crisis and the massive budget cuts that we saw at the state level. There was this unprecedented loss in revenue from a state agency perspective. I was working in state government at the time. Many people were taking furloughs. We were doing across the board cuts. Good programs had to be cut because there simply wasn't enough money for it. Thankfully, the General Assembly saw some wisdom in trying to save extra money. And so they did that. You probably saw on your ballots this past November, a couple of constitutional questions to add to our rainy day fund to be able to hopefully mitigate those. But we're still trying to catch up in a lot of ways. And so trying to fully fund, especially our human and child serving agencies like DSS to their fullest asking potential, which I believe we're poised to be able to do. That's really going to help us make up for that ground that we lost for such a long time. There's a lot of asks from a lot of people, but the investment we believe in is in our children because that's going to be our future.
Exactly. And just to add to that, Mason, another big concern that we're seeing now in South Carolina is the housing crisis and the homelessness that's out there. And I think as a General Assembly, we're going to have some responsibility to try to find some ways to help that. Just here locally, we actually had a school bus driver work every day driving a bus that found himself homeless, just did not have the financial resources for deposits and down payments and first month's rent and everything, and found himself in the men's shelter. I do think that the lack of affordable housing is a problem that unfortunately it's systemic, and that once that's there, it affects the entire family.
Oh, absolutely. And that's a very difficult and challenging issue for all states, and South Carolina is unfortunately not void of that problem as well. With the funding though, we've focused a little bit on some of the one-time funding, but how do you anticipate will be the best way to allocate the recurring funds that are coming into South Carolina to make it a better place for families to raise their children?
So you may have seen, I'm sorry.
No, go ahead.
So you may have seen this past week in the House Ways and Means Committee, their Health and Human Services budget hearing. Director Mike Leach, director of DSS, talked about a range of issues. And one of them is raising the board rates for our foster parents in our group homes. It's more and more expensive every single year, every single day to raise a child. And we have not kept up with our board payments to be able to help take care of these kids. Because these kids, while they're in foster care or in group homes, they're truly wards of the state. You know, the state is responsible for them. And so we have a responsibility to make sure that they're cared for. And a big part of that is funding board increases. Those are recurring dollars. As Representative Felder well knows, recurring dollars are the golden goose. Everybody wants recurring dollars, but they're a lot more difficult to allocate. So we have to be very careful with how we allocate them. But those board payments will go a long way to help that, both on the DSS side, and we also see that on our provider side with HHS as well too. For our kids, especially those with disabilities, those who are very poor, in those underserved areas where it can be a little bit more expensive to get healthcare, because about 60% or so of our kids in South Carolina are on Medicaid. And so we have to be able to pay competitive rates so that providers will participate in the Medicaid program so that kids on Medicaid can get healthcare.
And we're in a unique situation in South Carolina because of our geographically, we're small, a small state. So when you live close to the border of North Carolina, who has a higher Medicaid rate, or the border of Georgia that has a higher Medicaid rate, it limits your workforce. It limits that work pool. And unfortunately, you know, the medical profession is suffering as it is with the shortage of nursing staff. So I do think that's something we have to look at, is raising those reimbursement rates and making it more competitive to keep qualified medical providers within our own state.
Well, working in the health insurance industry and having worked in state government with health serving agencies, I can assure you that all providers would welcome that news and would get behind you in support of that if that can come to fruition. And you know, each of you have spoken, putting together the budget in South Carolina and working through it with the number of state agencies can certainly be a daunting task. So I support you and hope that you can sort through the dollars that are there and put them into the most effective places. You mentioned earlier some information about foster care and doing some things for foster care parents. Last session, there was a focus on passing legislation to establish a kinship foster care program. That proposal passed and was signed into law. And this year, Senator Shealy introduced Senate Bill 380, which would allow South Carolina to draw down additional Title 40 funding from federal government to assist in paying for guardianship placements. Guardianship placements are often with relatives or fictive kin who are not willing or able to adopt the child, but are willing to take legal custody of the child. Can you explain in more detail, Mason, maybe you've had a chance to work with Senator Shealy on this, how that could help South Carolina? First of all, if you'll answer that, and then we've got another question for Representative Felder.
Of course. So the Kinship Guardianship Assistance Program, otherwise known as KinGAP, adds another tool to the toolbox, so to speak, for helping families in need, which provides additional permanency option for children and youth in long-term placements with their relatives or fictive kin. For those that may not know, fictive kin is kind of like your Aunt Betty that's not really your aunt, but they were maybe somebody from church, or they were a school teacher or a family friend or somebody down the street that your family was close to, that you have some type of a familiar relationship, that they can kind of take you into their home and it wouldn't be such a disruptive time in the life of a child. But this program is intended to enhance that family preservation and the stability, as I mentioned, for those kids. It's an alternative route to permanency when reunification isn't really the most appropriate option for the child. Currently I think about 40 states already have kin gap or something very similar to it on the books. And I know a couple of other states like Georgia are working on that right now. We certainly don't need to be the 50th state in this category either. So it's really kind of time to go ahead and get this taken care of and just do it.
And Representative Felder, what benefits do subsidized guardianship programs provide for children and their families? There may be some things that we haven't been covered as yet.
I think it's the opportunity more so than anything. I think oftentimes a child, there are contacts, family members, caregivers that are willing, but unfortunately, financially, they can't afford because maybe they have to quit work in order to take this 2-year-old or 3-year-old or newborn baby. So I think it's very important that we find ways, creative ways, to allow these children to have a stable home, a place that they can call home. And that, realistically, as Mason said, that takes money. It takes money to raise a child. And it takes sacrifice to raise a child. And I think we need to find a way that the people that are willing to make the sacrifice, that we help them with the financial stability.
I want to add one more thing I forgot to mention. So S380 is going to be up in subcommittee this coming Thursday. So this kin gap bill will be heard 3 days from now. We also have another bill. We talked about homelessness earlier in the housing crisis. We also have another bill that would actually define in state law what homeless youth means and kind of the things that come around that. So both of those are on the docket for our Family and Veteran Services, our Child Welfare Subcommittee this coming Thursday.
Great. Okay, we'll take a look and track on that to see when it's actually going to be presented. Since Director Eden Hendrick has taken over the Department of Juvenile Justice, there seem to be fewer public reports or concerns that are being shared through the news media on safety problems at DJJ. We know issues still remain that need to be fixed, and she hasn't had that much of an opportunity as yet. But as both of you have been involved in South Carolina Juvenile Justice Reform Acts and been around that, what are some of the reforms that you believe that the DJJ needs to make, and how can the legislature ensure that these reforms are made?
I can take that one, Representative, if that's okay. There's no one silver bullet that's going to fix this issue. I mean, we all know that, right? Anytime you have families, especially or vulnerable populations involved, there's no one thing that's going to fix it. Because this is really a many layered problem that kind of got us to this point. We need to increase salaries for juvenile correctional officers. That's kind of something that we've been talking about a lot, both on the juvenile side at DJJ and the adult side at Department of Corrections. So we can attract, retain good employees that can work with kids, not just to warehouse them, but to really rehabilitate them. But we also need to really seriously address the pipeline that leads to DJJ in the first place. One of the big things that has kind of been a buzzword for us over the last several years are the status offenders. This might be something as simple as truancy, like someone not showing up to school. And unfortunately, right now under state law, sometimes they get locked up for that. Sometimes kids have gotten trafficked or gotten caught up in bad situations, and they just really don't belong in a jail setting. There are many other better places for them because there's honestly a lot of root cause issues here. They could deal with family dynamics, mental health, education, poverty, really you name it, it could contribute to a kid ending up in DJJ, which is in turn ended up with the overcrowding situation. I believe that they've been asking for additional housing space over there. But we also really need to be asking ourselves, why are some of these kids going there to begin with? And some of them just simply don't need to be there. In many countries in the world, Germany is one of them, where they don't even have lockup for kids. I don't think anybody in South Carolina is really going to be able to do that anytime soon. But perhaps we need to take more of a clinical approach to addressing these situations rather than a criminal justice approach to it. Because it's really going to end up being an investment for us because it's a lot more expensive, as you know, to house whether it be a juvenile or an adult in a facility than it is to just take care of the problem on the front end. Maybe give them services, maybe give them help, give them a job, give them education, help work with their home life, whatever it may be. Those investments will pay dividends in the long run.
Yeah, I would have to totally agree with Mason there. I think it is a matter of making that investment earlier rather than later. I do think that DJJ, we can't just warehouse these children until they reach a certain age and then put them out into the world and expect them to have the skills necessary to exist in that world. We have to find a way to rehabilitate them and teach them the skill set that they need to become productive members of society. And we can only do that with quality staff, quality mental health, quality services that these children need, and of course, that educational opportunity.
Absolutely. And I think one of the things, it's such a dilemma because what you were saying earlier, Mason, talking about the need for protective placement for children that need for some reason to be out of home, but they're not criminal in nature. And unfortunately, we have that a conundrum in the state because we don't have some of the needed housing availability. And so unfortunately, they do often wind up at DJJ. And we know that that there's all sorts of issues that are being addressed there. So good kudos to you for both working on that. And excuse me. Next question that we have, and I've gotten several in the chat, I'll try and get to those as well. According to the 2022 Annie Casey Kids Count data for South Carolina, we rank 37 in economic well-being, excuse me, behind North Carolina and Georgia. We know that for children to grow and be prepared, productive adults, parents need jobs for their family, sustainable pay, affordable housing, and the ability to invest in their children's future. A bill was recently, Senator Shealy introduced a bill to exempt baby food and formula from state sales tax. This will help families with infants better afford the rising cost of these items. She also introduced a bill to exempt diapers and feminine hygiene products. Questions for both Representative Felder and for Mason. What else can the legislature do to help families meet the rapidly increasing cost of living and provide well-paying jobs? That's a loaded question, I know, but.
Representative Felder.
It is a loaded question, but I do like a lot of the discussion we've had today. I don't think there's any one silver bullet to fixing all of this. But I do think, again, allowing our underemployed the opportunity to go to a technical college without paying tuition, I think that's a wonderful step in the right direction. And hopefully we do in South Carolina have a great technical college system. And the jobs of today are much different than the jobs of 20 years ago. So I do think that is a step in the right direction to help our families be self-sustaining. I do think that another thing we're going to have to look at as a state is some way of making affordable housing as we age and get elderly. I mean, South Carolina has an aging population. And when you look at living on a fixed income, even if your home is paid for, when you add your property tax, your school bond referendums, the other debts that are added, you have quite a substantial property tax bill there at the end. The homestead exemption, of course, $50,000, that helps, but we don't have much real estate in South Carolina that is not under $50,000. So I think we're going to have to look at making some changes there as well. And I do agree with what Mason said earlier. Child care, that has become a major problem in many parts of our state, and especially for those jobs that are not your normal Monday through Friday 8 to 5 jobs. Our health professionals, if they're working nights and weekends, they're very limited as quality, affordable childcare. So as a state, I think that's an area we're going to have to address. And the other thing I would like to mention is more healthy initiatives to teach children and young families how to be healthier, what foods to eat, make that more accessible, make it more readily available. We need to, like they say, walk more and eat less. And we have kind of gotten away from that, I think, during this hibernation during the COVID pandemic. And I think kids need to be active and families need to be active.
Couldn't agree more. 100% on board with what Representative Felder said. As you mentioned, Bev, Senator Shealy definitely introduced several bills this year to try to make it a little bit more affordable for families to have children, not just from paid family leave, but as you said, eliminate or repealing the sales tax on diapers, on feminine hygiene products, on baby food, baby formula, things that honestly, whenever I talk to people about it, they're like, I didn't even know we had sales tax on it. I can't believe we do. Why do we have it to begin with? And so certainly that's going to go, as a certain measure towards getting us to be a little more affordable for families. But ultimately, in the long run, I think a lot of our basis that we can kind of start from to support families in South Carolina and our economy it starts with education. As Representative Felder says, and as she well knows, having served on the education committee, that it doesn't have to be a 4-year degree, doesn't have to be a technical college program. It could be an apprenticeship or specialized training or certification, but just to help prepare our citizens for that future workforce. We've seen a lot of announcements over the last several years about major corporations coming in like Volvo and Boeing, some major electric car battery manufacturers that are coming into the state. All those are high-tech jobs that don't necessarily require 4-year degrees, but they require some kind of technical education to be able to have a ready workforce and attract many of those industries to come to South Carolina. We have a great port down in Charleston. We have a really good interstate system that can get you almost anywhere, up through Charlotte, up 95, over to Atlanta, and down to Florida. And so we really need to leverage both our geography and our education system to be able to kind of push us forward. So as we've said kind of all along, it's kind of one of the themes of today is investing early in K-12 and in our higher education, because that's what's going to end up saving us in the long run and building our economy for the future. We lost out on several decades of economic well-being whenever we lost all of our textile mills, as Representative Felder knows from her part of the state. And it really hit us hard in South Carolina. So we have to be more forward-thinking about what the next industries are going to look like. And I think we're really doing a good job of that, of looking towards whether it's high-tech industries, there's some movement, especially in the upstate, on the fintech or financial technology, and a lot of the research base. We're trying to do a lot of work with our three major research universities, MUSC, USC, and Clemson. A lot of them are coming out with ideas and partnerships with the private sector that are enabling us to hopefully build our economy and attract good quality employers. But those large scale employers aren't the answer to everything. A lot of it's going to be mom and pop stores that we have to be able to support as well. Those small businesses that maybe are trying to find their way, and support them as well too, and whatever that kind of looks like.
Thank you. Those are very insightful and interesting. We've had some interesting comments posted or questions also posted in our chat that I want to jump over to. One, just as a thought or just an idea that was thrown out there, is there any funding available from material needs banks like diaper banks and supply banks, I guess much like the food banks that we're familiar with, that the state might be interested in hosting or assisting with? Those are some interesting concepts and a different way to think about answering people's needs.
Sure. So I'm unaware of any funding right now for that. Representative Felder may. So I don't know about any funding. I do know of several nonprofits that try to help out with baby banks or diaper banks, kind of depending on your area, whatever you call them. But that the need is greater than the supply of what we have in those banks, unfortunately. And maybe at some point that we may need to address that in a state appropriation. It always gets harder whenever you start appropriating money to nonprofits like that. So I don't know exactly how that would work, but that has started to bubble up into the conversation that we have heard at least.
Yeah, I would have to say in my area, a lot of our food banks, they are also having the diapers and the baby formula and the baby food on the shelf as well. That's because the need is there. So that has expanded. But again, those are local nonprofit organizations that are doing that without any state funding that I'm aware of.
Mm-hmm. It's just an interesting concept. I had not really thought about that as an organized way to assist members or assist citizens in our state. There was a follow-up question.
I guess one of the areas that I would look at is perhaps BabyNet would be kind of the housing location for that. Again, I don't know specifically if they would be able to provide that, but they may be kind of the first first go-to for those 0 to 3, I believe, that serves the BabyNet serves. I did see one comment in the chat about the Period Project. That's a project that Senator Shealy has been involved with as well too. There is some discussion about trying to address this in the education budget formula to be able to help support these products for young women in our schools. It's, as one can imagine, it can be a very difficult time, especially whenever a young lady is first starting out with her menstrual cycle. And a lot of times that happens at school. And a lot of times we don't have those resources available to them. And so that's something that we're starting to talk about as well too, is how we can get them into schools, have the school nurse kind of hold on to a set to be able to provide to a kid, in their need.
There was a follow-up question related to foster care and adoption, and asking if you can share any feedback on the Bill 3201 Foster Care Adoption Study Committee that was introduced by Representative Hagan and Representative Neil Collins.
I'm personally balancing around 40 to 45 bills right now, so I have not read that one yet because it hasn't come across our desk. But I will say that we get a lot of requests for study committees over time. So sometimes they're met with anticipation or concern that perhaps the outcome of it may not necessarily move the needle, so to speak, but we're always willing to try to research an issue more in depth. And certainly if it makes its way over from the House, we'll be happy to take a look at it in the Senate.
And I apologize, I'm not familiar with the bill at all to really say what, to kind of reiterate Mason's point there, though. We know we have a problem. There's not enough money, there's not enough resources going into foster care, there's not enough oversight of the system. I don't know what more a study committee could tell us.
Yeah, okay. Well, that was just a question from one of the attendees, so I thought I would see if there was any insights you could share. I think the other thing—
I will add one more piece to that. I'm sorry, I apologize. Sure. I didn't mean to interrupt you, but so the Legislative Audit Council, by law, every 3 years has to review a program at the Department of Social Services, and foster care is one that has been reviewed in the past. It's been several years since that has been the case, but of course there's many programs that fall up underneath DSS. I believe SNAP was the most recent one that was reviewed by them. So they have another review from the LAC coming up in about 2 years, give or take. But we also have a House and Senate oversight committees that are constantly looking at all of our state agencies and kind of rotate them through on a cycle basis. So it's certainly, foster care is being looked at. It's being looked at constantly. And even beyond that, we're still under the Michelle H. Settlement agreement right now. And so the federal court monitors are constantly looking at foster care as well too. So in effect, they just had a hearing in federal court with Judge Gergel, I believe a week or so ago. He actually called out the Ken Gap program bill that Senator Shealy introduced and said that it was could be transformative for our state. So we were certainly appreciative of those comments. But so I just don't want there to be any takeaway that nobody's minding the store on foster care. There's a lot of people looking at it right now, from the General Assembly to federal court monitors. And we really have a great director there right now with Mike Leach.
I'm fairly confident that the people who are attending this do not believe that there's not attention being given to it. We recognize some of the just the complexity and the difficulties associated with everything. The other thing that was posted in the chat that I think is of interest and fits well within our discussion today is around some of the difficulties that families encounter related to childcare. And even with the voucher program that is available to foster families, there are lots of challenges in finding openings where there's availability in licensed childcare facilities. Just as a comment from one of the participants is that we need to get more creative about funding childcare for foster families and for others. I mean, that's just a reality that a lot of people encounter, that, there's sort of a joke about people need to get on the waiting list before they even ever think of getting pregnant, because there's such needs. So what are your thoughts related to some of the things that could be done from a legislative perspective there?
I certainly have some feelings on that right now. My wife is pregnant with our first child. And so she's in her second trimester right now. And so we've probably applied to about 10 different childcare facilities already. We have not been guaranteed anything yet. Obviously it's still very early, but we're a family of means. She and I both have really good jobs. And I see the tuition payments for all of our childcare, and it is eye-watering how expensive it really is. It makes you wonder. It's like, maybe we just have one child. I don't know. But it is really, it's a crisis for so many areas. I remember a story several years ago Up in Dillon County, whenever we got a very large manufacturing and distribution center up there, I believe it was Northern Tools or something like that. But whenever they moved in, and many of the workers moved there to Dillon County, which is extremely rural, as you all know, and there was no childcare around. There was nothing. And so the facility actually had to open up their own childcare facility because there was no private options in the area. But many employers don't have that option. They don't have the means or the capacity or, quite honestly, the resources to be able to provide childcare for their employees. But from a General Assembly's perspective, again, I hate to be a broken record, but that's going to take investment from us. It could be in the form of tax credits. It could be in the form of, both for the facility who would be starting and for the families that would need to be going, kind of hitting both ends of it. It could be, cheaper licensing. Again, that's going to take state recurring dollars to be able to withstand. A lot of these child care facilities, if they're going to do it right and provide benefits for their own employees, that's very expensive. And so perhaps there's ways that we could help them with that too. There's not a whole lot of really good, easy, cheap answers for this. They're all very complex, expensive answers, honestly, for this particular problem. But it's a growing need, and it's not going to get any better by just hoping and praying that the free market fixes itself, because it so far has not shown that it's capable of doing that.
Okay, we have a few more questions that I want to get to, knowing that we won't ever be able to cover all of the inquiries today in one short hour. But one of the, a lot of the questions we received were around education, with one major theme being the teacher shortage. Representative Felder, you've served on the House Education and Public Works Committee. What are some ideas that have been tossed around to improve teacher recruitment and retention that you could share with us?
Yeah, teacher recruitment and retention is a serious problem, not only in South Carolina, but it is now across our country as well. People are not going into the teaching profession, and those that go into it, it's hard to keep them more than about 5 or 6 years. So we've got to think outside the box to attract quality educators. We also have to look at, why are they leaving the classroom? A lot of that is discipline and lack thereof, the workload, the teacher burnout. Some of our districts have actually changed to a modified school calendar that allows teachers to have more time off during the school year to try to recharge those batteries, rest up, because it is a very, very demanding job. I think another thing that we're looking at, and very thankful to the General Assembly, we have raised teacher pay. We have put the dollars there to get teacher pay up. But I think along with that, teachers want us to get those wraparound services that child needs. The teacher works with that child one-on-one on a daily basis. But if that child needs mental health therapy, behavioral, that teacher needs to know that we can provide that service.
Representative Felder is completely correct on that. And, one of the things that we have done from the state and the district's perspective is we've put a lot on teachers' shoulders, just like with law enforcement. We're asking both law enforcement and our teachers to do so many things that many of them never went to school for. Whenever you're going to university for elementary school education, you never imagine you're going to have to counsel a child on their home life or their mental health, or who do I report this neglect to? How do I handle behavioral issues in my class in a constructive way that is not going to be damaging to that child? but also is recognizing that there are other children in the class too that deserve the ability to be able to learn as well. So trying to maybe take some of those things off, like Representative Felder said, off the shoulders of our educators will be really important. But that doesn't mean that those issues go away. It means that we need to find the right people to do those as well too. And that's where those wraparound services come in, allowing the appropriate behavioral health specialists and mental health counselors into the schools is important. Our nutritional assistance in schools is important. Making sure that we need to address school start times. That's something that we see in the Children's Committee fall hearings every single year, is that our little ones are getting up at 5 o'clock in the morning, 4:30 in the morning, to be able to get up, get dressed, eat, be on the bus at 6:30 in the morning, and then to school by 7 o'clock for a start time. That's not necessarily sustainable for a child, at least for their, to be able to focus throughout the day. And it's also not sustainable for a working family either, especially many of them that do have 8:30 to 5 jobs. And that kind of then goes into the after school childcare question as well too. So they're all kind of linked in together. And this is not an easy problem to fix, but it's one that we have to. We really don't have a choice in it.
Thank you. This hour has flown by in my eyes. We have additional questions that are continuing to come in that we know we can't get to right now. But we do want to take this on behalf of Children's Trust of South Carolina. Thank you, Representative Felder and Mason, for your willingness to stand in today for Senator Shealy, who had a personal issue going on. We know that you will do your best during this upcoming session to get out in front of the needs for children and support the families across our state. We do appreciate your time today, and thank you for being partners with us, and we look forward to working with you, and know that we're available in addition to, if you get a chance to look at the chat, all the things that are coming through, all the people who want to be supportive and work with you to help resolve the problems that our families are facing. So thank you today.
Thank you.
Thank you, Beverly. Appreciate y'all having us.
Okay. Take care. Bye-bye.